Everyone, and welcome to this HERO webinar featuring Purpur Vries from Stanford. I am Jessica Grossmeyer, HERO's Vice President of Research, and I'm serving as host for today's HERO webinar. I'm honored to introduce you to HERO member and my good friend, Purpur Vries. If you check out Patty's LinkedIn page, you will quickly learn an impressive list of accomplishments with all manner of descriptives, including book author. In 2011, she published The Soft Side of Success, entrepreneur. She started a fitness and wellness company in the 1990s, growing it to more than 100 employees, serving Silicon Valley corporations like Cisco, Yahoo, and Safeway. Athlete, she attended Stanford University on a full athletics. Hello, and welcome to this Stanford webinar featuring Purpur Vries from Stanford. I am Jessica Grossmeyer, HERO's Vice President of Research, and I'm serving as host for today's HERO webinar. I am honored to introduce to you HERO member and my good friend, Purpur Vries. And if you check out Patty's LinkedIn page, you will quickly learn that she has quite an impressive list of accomplishments with all manner of descriptives, including book author. In 2011, she published The Soft Side of Success. Entrepreneur, she started a fitness and wellness company in the 1990s, growing it to more than 100 employees serving Silicon Valley corporations like Cisco, Yahoo, and Safeway. Athlete, she attended Stanford University on a full athletic scholarship and was a 9-time NCAA All-American and competed at the 1988 Olympic trials. In addition to being a Stanford alum, Patty also currently wears 2 professional hats at Stanford. The first is as director of the Stanford Health Promotion Network, which is where I first met Patty. The Stanford Health Promotion Network is a member-based network of employers, health systems, and wellness vendor suppliers in Silicon Valley, and members include household names such as Apple, eBay, PayPal, Kaiser Permanente. SHPN holds quarterly educational and networking events, many of which I've had the good fortune to be able to attend, and brings quality expertise from industry thought leaders including Tom Rath, BJ Fogg, Chip Conley, and coming up, as you can see in the lower right corner of their webpage, Ron Gessel, HERO member and chair of our board of directors, will be featured at an upcoming event. Patty's second hat is in a director role in the Stanford Medicine MD Center, and it is in that capacity that she will be sharing her work with us today. We're just coming off of our HERO Think Tank, which, Patty, it was delightful to see you here in person in Minnesota. Thank you for joining us for that. And at that meeting, we addressed the systemic approaches to addressing mental and emotional well-being for employees. Those of you who joined us for our February Think Tank at HERO in San Antonio got a preview of what Patty will be sharing today, which is how they are taking both a systemic and an individualistic approach to addressing the well-being of physicians. And so, Patty, with that, I'd like to turn it over to you and get us started with today's content. I want to remind everyone that we will be saving time for Q&A at the end. Please don't wait for the end, though, to lob your questions at us. As Patty's speaking, be using the chat feature within our webinar system to be sending us your questions, and that will give us a chance to be monitoring what questions are coming up as we go in, and then we'll be saving time at the end of Patty's presentation to address your questions. So with that, Patty, I turn it over to you, and thank you so much for joining us today.
Thank you so much, Jessica. I had a wonderful time in Minnesota with all of you and the incredible minds and personalities and passions of the members of the HERO community, and I just can't say enough about that. And it really does tie well into what we're doing here at Stanford, which is really trying to advance the well-being of our physicians and our care teams through a model of professional fulfillment. This model was created by the MD Center, and we're going to be sharing a little bit about that. We're going to talk first about drivers of burnout and how we came about to creating this model. We're going to talk about our vision for professional fulfillment, including personal resilience, the domain of culture of wellness, and the culture of efficiency of practice, and how this can apply to your organization in order to elevate wellness and also meet the needs of our employees. So the drivers of burnout, and this is particularly for physicians, but we've learned but in particular in the last few years when burnout has increased nationally to a rate of 54%, we're seeing a lot of pressures on our physicians. Those same pressures with the increase in technology, a lot of the same pressures are onto the workforce in general, not just in the hospital community, but in workloads and work communities all across the country. Burnout is really defined as emotional exhaustion and interpersonal disengagement. How are we interacting with other people? And we're learning a lot about the impact of either positive or negative interactions with people. And so once you have personal disengagement and emotional exhaustion, it really does lead to burnout. At the WellMD Center, we've decided that burnout is really vital. We really want to reduce our levels of burnout, and we want to help nationally to reduce those levels of burnout with our physician communities and, again, with our care teams. But we've decided to aim higher than reducing burnout, and what we really want to do is seek professional fulfillment. So our vision is to help our employees, from our physicians and our janitorial staff all the way up into the C-suite and our CEO, to have professional fulfillment in their work. Dr. Mickey Trockle from our WellMD Center has defined professional fulfillment as happiness or meaningfulness, self-worth, self-efficacy, and satisfaction at work. And I know for me, and I'm not a physician, I really want to wake up every day and I want to know that I'm going to work and I am professionally fulfilled. So how do we get to that point? In 2013, our team, and I wasn't on it at the time, so I say that very broadly, measured burnout and wellness from our physician community. In 2016, we developed the model that I'm going to share with you, and we were able to validate our survey instrument and then re-survey our physicians in 2016 to really take a good look at what was causing the burnout. We do have a published paper on the conceptual framework that I'm sharing, and that link to that is there, and I'm sure Jessica can send that out to anyone who's interested in it. Really, the model is looking at professional fulfillment as an intersection of areas of our work and personal life coming together. Traditionally, wellness is focused mainly on personal resilience, but what we're trying to look at and what we are looking at is how the culture of wellness and efficiency of practice really plays into that domain and how it impacts our professional fulfillment of not only our physicians, but of the whole care team. So personal resilience, we've defined it as the individual skills, behaviors, and attitudes that contribute to physical, emotional, and professional well-being. What we learned from the survey from 2013 into 2016 is that the strongest determinants of burnout are low self-compassion, and that may be a new term for some of you. What we learned at the Hero think tank is that many of us may think that it is a fuzzy term, but what we're really learning is there's some hard science behind it. The second highest was sleep-related impairment, and then low meaningfulness of work. So those are all areas we want to work on and make an impact in. The way we look at self-compassion is that it's really needed, particularly with our physicians, but with anyone who is really striving to be the best they can be in their work world. The pursuit of perfect medical practice and the pursuit of high-level work really demands that we're perfect. And there is no perfect person, there is no perfect work effort. And so the only way to bridge that gap between the pursuit of the perfect medical practice and the acceptance of the human condition is through self-compassion. And when you're shooting for perfection, but you're limited by the human condition, really self-compassion is the only way to make that happen, because we're all going to make mistakes. That's an area that you're going to see a lot more work at Stanford Healthcare in looking at that need for self-compassion and cultivating it. One of the pieces that we learned through the survey is that our female physicians are burned out at a much higher rate than our male physicians, and we think that self-compassion may be playing a pretty big role in that. Now, of course, at Stanford, we're not overlooking the basics. We have outstanding athletic facilities. We have over 1,000 classes a year offered by the Health Improvement Program, everything from yoga and meditation to athletics. We also have a lot of other resources available, and Dr. Vries has done a beautiful job on our website at wellmd.stanford.edu. And if you get a chance to look at that, you'll learn more about the model and more about what we're doing here at Stanford. The second piece, which is my personal passion, is around the culture of wellness. And we've defined that as organizational values and actions that promote personal and professional growth, self-care and compassion for ourselves, our colleagues, and our patients. What we learned through the survey is that leadership support was identified by over 60% of our physicians as being very important to improving their professional satisfaction. So that, again, is another area we're going to be looking at in the coming year of how that impacts. We've used the leadership questions that have been developed by the Mayo Clinic under the guidance of Dr. Tate Shannonfeld. Those key questions are very important, and what we've found is that when a leader cares about their employees, shows interest in their job and conversations about their career, they feel much more supported and their area of professional fulfillment is increased. So again, that's an area that we're going to be looking at a tremendous amount in the coming years. Some of the things we're doing around culture is that we're creating wellness-infused team trainings that incorporate everything from the entire care team. I work very closely with the director of the wellness program for all the non-physician employees so that we can bridge that gap. We've created grant programs for the non-physician employees, and we're going to be creating a new grant program for our physicians, along with champion networks. We are looking to create the network, a revised version of the network that will ask every department to identify a champion in each of the 3 domains so that we can really start making an impact on the culture. Under efficiency of practice, which may be for many of you the least well known, is really the workplace systems, processes, and practices that promote safety, quality, effectiveness, patient satisfaction, colleague interactions, and work-life balance. What we found is the higher our physicians perceive the usefulness of the EMR, the higher they are professionally fulfilled. Now, for your work world, it may not be about Epic, which it is for us, that Epic is a real struggle for our physicians, but it may be about workflows, it may be about technology that is causing issues for you to be able to really focus on your professional fulfillment and what you do best in your job. Certainly, many of us have had days where we're struggling to get something accomplished. There's the paperwork, there's inefficiencies, it's difficult to get things processed. We often call that red tape. But what we're finding is the higher the degree of inefficiencies in our work world, the more it drains us from the joy that we could have in our jobs and the professional fulfillment that we have. So that is the model that we've created that seems to resonate with our employees. Our employees really want to be professionally fulfilled, and they seem to want to go towards that centerpiece and help us find ways to make that happen. They see themselves in that. We've shared this model across many of the departments, everywhere from the janitorial staff up through the nursing ranks, up into the C-suite, and it really seems to resonate. Often we come to work and we're struggling in any one of these domains, and if we can get back to really focusing on how to have that professional fulfillment at work, that's important. Now, a key piece of this model is that the blue section under personal resilience is really about the individual contributor. Are we giving them the tools and resources for them to come to the table as a healthy, happy employee? But if you notice the 2 sections in red, the reason they're red is because we're pointing out that those are responsibilities for our organization. So we feel that an ideal balance is to have 1/3 of our resources going towards the personal resilience domain and 2/3 really trying to impact at a very high level what we're doing to either support our employees or take away from the joy they have in their work. So we've asked our employees and our teams to really look at their sphere of influence, and I would encourage you to do the same as you may be looking at spending your time in potentially different ways in the coming year. That we each continue to cultivate personal resilience in ways that are meaningful to us, whether we want to run, meditate, lift weights, however it is that we are eating, moving, and sleeping in a way that supports our optimal professional performance, that we contribute to a culture of wellness in ways that are positive and inspiring for our coworkers, and that we collaborate across the organization. Many of our organizations have deep silos that don't speak to each other, and what we really want to encourage is collaboration across the organization at a high level so that we can continue to make progress towards growth and professional fulfillment. I've created a little bit of a different model here with some different words in case it resonates better with you as we're having this discussion. Instead of personal resilience, maybe it's personal well-being, if that resonates with your employee workforce. And instead of inefficiency of practice, maybe it's operational excellence. Maybe that's what the C-suite wants to hear. And oftentimes with employees, they want to also hear that there's growth. So maybe professional growth and fulfillment. And above all, I want to encourage us all to celebrate successes as we're making progress to really create a healthier culture, a culture that we all want to live and thrive within. I want to acknowledge so many people on our team, Dr. Brian Bowman, Dr. Mickey Trockle, Mary Lou Murphy, who's our administrative director, Miriam Hamidi, who has done a beautiful job in our data, Kate Shannonfeld, who allowed us to use his leadership questions, Vries Stein, who has created a beautiful WellMD website, Dr. Wes Alice, who oversees the Healthy Steps and the Be Well programs, and HIP, and Sherelle Fernandez, who's the director of the Healthy Steps program. And with that, I want to hand it back over to my dear friend, Jessica.
Great, thanks so much for that, Patty. And I just have so many questions I want to ask you to unpack some of the information. As I'm doing that, those of you who have questions for Patty, please do be using our webinar question feature to get those questions to us so that we can direct those to Patty as well. But just to start off with, Patty, you said, let's talk a little bit about self-compassion. You mentioned that might be a concept that's unfamiliar to some of our listeners today. And I believe you said that women, you found, were more vulnerable and seem to be more lacking in self-compassion. Is that correct? And if so, what do you think is undergirding the relationship that you observed in your data?
Well, if I can share a story, and I'll try to make it brief. Well, the data shows that our physicians, and we're fortunate because, as I mentioned, nationally, burnout rate on physicians is 54%. Our male physicians are burned out at a rate of 28%, and our female physicians are burned out at a rate of 39%. Mickey Trockle did a beautiful example of what we believe may be impacting that. We were sharing the data with a group of primary care physicians, and he asked everyone to think of a time when they made a mistake. Think of a time when you maybe just really blew something and you just, maybe you felt bad about it because it was a pretty big deal. And he gave everyone a minute or two to think about a time, and then he asked each person to think about what their self-talk was surrounding that mistake. And he happened to call first on a female physician, and the female physician said, my self-talk was really, wow, I'm careless, and maybe I'm not cut out for this work. Then he called on a male physician, and the answer was striking. The answer was, I'll do better next time. I believe there's a real opportunity there for us to look at our self-talk, to look at the levels of self-compassion, and to see where those burnout levels are happening. One of the things that I didn't mention yet is that what we've discovered is physicians who have symptoms of burnout are twice as likely to leave the organization within 2 years. So when we surveyed in 2013, we were able to see those and identify those physicians who showed signs of burnout. And then we were able to look at the data 2 years later to determine who had left. And those physicians who had signs of burnout were twice as likely to have left. What we also were able to confirm is nationally and from our HR department here at Stanford is the cost to replace a physician is between $250,000 and $1 million, which means if we have 88 physicians who may leave in the next 2 years, that could cost us up to $88 million in replacement costs. That's powerful.
Yeah, definitely. And how was that information in your data useful in helping you to get the attention of leadership and to get leadership support to tackle this going beyond individualistic approaches and really tackling some of the systems and organizational things that needed to change? Was that data helpful? And if so, could you say a little bit more about how you've engaged leaders to get their support for some of the more organizational changes you wanted to do?
Well, the data is really powerful. The numbers are powerful. Our organization wants to do right by our physicians and our care teams, and certainly for our patients. It doesn't serve our patients if our physicians are burned out, and there's plenty of data on that. And it doesn't serve our whole care teams. Those who are burned out, again, the disengagement, the interpersonal disengagement, is really a strong piece of that burnout. And so what we want to do is change the system. It's obvious that if nationally physicians are burned out at a rate of 54%, this isn't about a group of non-resilient physicians. There's something systemic going on that's causing this burnout nationally. And we want to find out what's causing that, which is why we started looking in 2013 at the different categories and the different domains. When we did the survey in 2013, what we did is we looked at all the areas that we received information about that was causing stress, anxiety, and burnout within our population. And we categorized those elements into 3 domains. That's how we came up with the model, is looking at the 3 domains and putting those together. And again, instead of putting reducing burnout in the center of the model, we wanted to shift it to really seeking professional fulfillment. We believe that if every member of our care team, every member of the organization is professionally fulfilled, it will transform our environment.
Perfect. Let's talk a little bit more about your model, Patty. You had mentioned that what might be meaningful for some organizations, maybe that aren't healthcare or health systems organizations, that it would be about operational excellence. Can you say more about what you mean by operational excellence more broadly? Is it about an organization trying to reduce hassles that make it hard to do one's jobs effectively? Is it about increasing employee morale and pride? Can you say more about how that might translate to a broader organization?
Mm-hmm. Certainly the employee morale and pride, I would probably put in the culture piece. Under the efficiency of practice, maybe how shift changes work, and we heard from Monica Warline that she's working on making shift change transitions a more positive, effective way to do it. She's actually using compassion to do that. Efficiency of practice may be, and we were discussing this just this morning, is how the food supply. How is the food supply supplied to our organization and our teams in a way that helps them have their optimal performance as an employee? How does HR support the work that we do? Does it take an hour to get a reimbursement submitted? Is there a way to make that more efficient so that we can spend more time doing the work that we are passionate about, using our strengths? There's a lot of work done around strengths through Gallup organization, and if my strengths lie in one domain, but I'm having to essentially run through yards and yards of red tape in order to be able to spend 2 hours a day doing what I'm passionate about, that reduces my professional fulfillment. So whether the printers aren't running properly, whether IT doesn't run fully, whether our email system goes down, and these are things that maybe don't happen as often anymore, but oftentimes I see inefficiencies of practice within different departments. Are those departments doing what they need to do, what their professional fulfillment is about, so that I can more fully focus on the area of my job responsibility that I find professional fulfillment in? How do we make our workflows, our systems, our technology all support the efficiencies of practice so that we can spend the time doing what we actually do best?
Okay, well, we've got a lot of questions pouring in here. Andrea Bloom asks, going back to that observation around female physicians and the lack of self-compassion, what do you suppose the undergirding reason for that is, in addition to what you've already shared? Do you know if female physicians tend to be less likely to have like a home-based support network, or can you say more about the potential contributors that you've identified in working with your female physicians?
Sure, and hi, Andrea. She's one of our members, and thank you for joining us. Yes, we started having forums with our female physicians to talk a little bit about what might be driving that. And certainly not having support at home is a big piece of it. Not feeling that they can call in when their child is sick, to be able to stay home. That torn piece, and again, that goes back to potentially self-compassion. If they have a sick child at home, yet they have patients, and so they're torn between caring for a sick child at home, and maybe they don't have the home resources, and caring for their patients. And so they oftentimes will put their own self-care at a minimum instead of making those hard choices. Women have some very specific needs, whether it's with child rearing, childbearing, even trying to get pregnant. There's a lot of issues that may be difficult for them to bring to the table in a very male-dominated company, and that's not necessarily here at Stanford, but within your organization as well. Not all women have trouble with self-compassion, but I know a lot of them personally that we struggle with it. We struggle with making those hard decisions that help us balance our work life.
So talking a little bit more about physicians, do you have any data on why physicians, and maybe you have a different experience of this at Stanford, but we know traditionally it's been very hard to engage physicians. So Valeria Tivnan, one of our HERO members, asks if you have any data on why the physicians might be less likely to participate in health and well-being initiatives that are there to support them in helping to prevent burnout, but they just don't take advantage of it. I can guess what some of the common reasons might be. What have you discovered about that in your organization?
Certainly it's time for a lot of them. Certainly there's a culture that they are strong, they know what they're doing, they can handle this on their own, they don't want to show weakness. And that's probably true in many industries, in many places. There's that expectation that we're above needing help and support. So creating a place, again, where we're compassionate with each other and self-compassionate is a really powerful thing. What we are learning is that our physicians want to be part of the solution, and this is why we're creating both the Champions Network and the grant program together, so that these great ideas for changing the culture, changing the inefficiencies of practice, and offering resources for personal resilience, we want the physicians to come to us with the solutions. They like being part of the solution. They don't want to be told, we created this program and this is what we want you to do. They want to be part of creating that. So we are going to be allowing them to do that. And we've already gotten some great ideas, some great collaboration through our physicians. They really do want to be part of it. We just need to give them the space and the opportunity to do that.
That's right. So how are you engaging your physicians? Do you have some sort of a formal steering committee or something to try to get that feedback and be very proactive about engaging physicians to get their support on what the solutions are?
Yes. Mary Lou Murphy and Brian Bowman created our physician wellness committee about 5 years ago. So we have a core of about 65 physicians at Stanford Medicine for both the hospitals, Lucille Packard, Children's Hospital, and Stanford Healthcare. We come together once a month. We often have speakers. We talk about what's happening in the organization and what we could make changes. And in fact, tomorrow we're going to be bringing a lot of the data from our 2016 survey. We're going to be really looking at the 3 domains and ways that we can more fully impact those. We've got some ideas within the WellMD team, but what we really want to do is bring those domains and that opportunity to our physicians so that they can help craft the solutions.
And so as you come up with some of those solutions, are you finding a need, or have you partnered with organizations like organizational development and learning, EAP, some of those internal partnerships to help address some of those organizational systems and organizational change issues that you've talked about?
Yes, I was really fortunate that from 2013 to 2016, I oversaw the employee wellness program for all the non-physician employees of the 2 hospitals. So we have a lot of those really great relationships, particularly with the Healthy Steps program, which is the program for the non-physician employees. I also am part of the Be Well team that is the university wellness program. And so looking at those at a very high level, talking with the C-suite, talking with our chief executive officer, our directors of human resources, and finding ways to really bridge those gaps at a very high level so that we're all working together. I know at Lucille Packard, I've worked with the training and development in the past, teaching what we call wellness-infused team trainings, so that we go in and we create a positive work culture for the teams to work within. So it really takes collaboration. I think that point was hit home beautifully at the Hero Summit the last couple of days. And we really, it's an opportunity for us to elevate wellness in a way where we're having discussions at the very highest level of the organization. Oftentimes, wellness will be put in the fitness center and checked off the box that we have a wellness program. Yeah, it's down in the basement or it's on the other side of campus. Instead, what we're really trying to do is say that's a part of a much bigger opportunity to help our professionals to be professionally fulfilled. And I just like to try to imagine an organization where I'm working with colleagues who are professionally fulfilled, literally from the janitorial staff who just love their job. And I believe it was in the book by Charles Duhigg, The Power of Habit, where he talks about the janitorial staff at a hospital who feel that they truly are impactful on saving patients' lives because they're the ones that keep everything clean and sanitary in our hospital system. That's the power of professional fulfillment, allowing them to do their job, helping them with efficiency of practice, creating a positive culture, and giving them the tools to be their best.
Yeah, and you mentioned C-suite and engaging senior leaders. At the Stanford organization, how is the C-suite or is the C-suite held accountable in any way for advancing professional fulfillment and addressing some of these issues? Or is it all on the physicians to try to figure out the issue to that? Are the C-suite in any way taking accountability for making some of these changes to help support operational efficiency or inefficiency of practice?
Our C-suite is very much involved. We have had many meetings at the high levels when it comes to IT and possible changes to the way EPIC is delivered and used. We are working with high level when it comes to our food supply. We are starting these conversations and they are very much engaged. We are in the process of recruiting our new director for the WellMD Center, and that new director will report to the dean of the medical school and have a dotted line to the two CEOs. So we're really excited about that opportunity because it's really being put at a very high place. We are actually hopeful that this new position, and I believe this is what's happening, is will actually be the chief wellness officer for our organization. To me, that puts us at a place where we're really talking about how wellness impacts our ability to do our jobs and our professional fulfillment going forward.
Yeah, that's terrific, just to have that level of leadership and buy-in. One of the things that I wanted to ask about, we've had some great questions coming in from med students who know some of the data that are out there. They're concerned for their own well-being, and I'm going to ask you two questions because they're related. And one of the students asked, as a med student, can I delay my own burnout? So there's a little bit of fatalism in there. I'm going to get burnt out, and can I delay it? And then the other question was, I am currently, as a medical student, already considering changing to a PA position to get better life balance. Can you say a little bit about some of these questions and these trends? Are you interacting at all with residents and medical students to help get in front of this at Stanford?
Well, first I want to thank our medical students, and I don't want to cry because I will cry. I get really emotional when I thank our physicians and our residents and fellows. And we do work with them. They are part of the Healthy Steps program, which is another reason I work really closely with Sherelle Fernandez on the employee side. It's really impactful when you're thinking about, like you said, the fatalistic approaches. Can I delay the burnout? There are certainly ways that you can take good care of yourself. That self-compassion piece is really important. And if you are a resident here or a student here at Stanford, I hope you will reach out to us because we do have resources and we have people that care very deeply about your health and well-being. And we're working on programs. In fact, one of the programs that we are working on, we're going to be creating a program for our palliative care fellows, and that's going to include the self-compassion piece. It's also going to include the strengths-based leadership piece of it, to really get to know your strengths, and I think that's really important. We're all very different, but if we can find a way to capitalize on our strengths in the process, I think that's really powerful. We also want to give you those tools. I do want to say that this, the nation is starting to shift. We have a conference this fall in San Francisco. We're hosting it with the American Medical Association and Mayo Clinic, where we're going to be really talking to organizations about how they can create a more positive culture through our model. The model is going to be the guiding framework for the conference, and what we're really trying to do is share this information across the country so that it can be better for our physicians, it can be better for our residents and our fellows, and that it's going to be a brighter future, and that we can reduce burnout and raise professional fulfillment.
Someone wants to know more about your grant program. So can you say a little bit more about that?
Sure. On the employee side, we've been running the grant program since 2013. What we're doing with the physicians is, again, I want to emphasize that the physicians have incredible ideas and they know what's needed in their domain and in their specialty. So what we're crafting, and Nikki Trockle is leading this piece as well, is we're creating a framework so that we can guide somebody through the process of measuring a pre-intervention, creating an intervention, and then measuring post-intervention, so that we can really look at the effectiveness of some of these grants. We're going to be giving the guidelines. They'll apply for the grant through the guidelines. They're going to tell us how they want to measure it. We'll give them ideas on how to measure, how to craft a successful intervention, and then how to measure post. And once they create that grant application through that process of a step-by-step application, what we're actually wanting to do is give them seed money. So that seed money, we've requested a fairly substantial amount of money for 2017 and 18 fiscal year, and to be able to give grants. It could be as small as $200 for some journals to use for 3 good things in their organization, in their department. And it could be, we haven't set an upper limit yet. We have to wait and find out what funding we actually have, but we've asked for a pretty substantial amount of money that would really be able to plant some seeds across the organization.
Wow, that's fabulous. We're going to go to a poll question. We still have 80 attendees with us, so thank you for those of us joining us, and we would like to get some feedback from you. Patty, you had mentioned that one of the real eye-openers for the business case was looking at the cost of turnover in your organization, and that really helped you to get some leadership support and buy-in on the need to address this. So we know that in a healthcare setting like Stanford, turnover is a pretty costly issue. And what we would like to know from those of you who are attending today's session, is turnover something that you might include in your business case for health and well-being? Is that a cost driver or a concern for your organization? And so the poll answers are yes, turnover is relevant and could be added to my business case. Maybe it's relevant, but a stronger link between what we're doing in health and well-being and turnover is needed in order to make that link. No, turnover is not an issue, or no turnover, or leaders don't think that our initiatives are related to turnover. So those are your response questions. Go ahead and submit your responses to the poll question. And Patty, as you think about healthcare systems, you know, is turnover one of the key business case drivers, or are there other business case drivers that you are using in your business case within a healthcare system?
Well, certainly for the healthcare system, as I mentioned earlier, we're seeing the cost of 88 physicians over the next 2 years costing us anywhere from $11 to $88 million. So that is certainly a business case. Further, it impacts our patients. And as a hospital system, our patients are at the center of everything that we do. So when those turnovers affect our patients, which they always will, that's also a huge part of our business case.
All right. Well, let's see how folks on the phone feel about turnover, and we're getting those poll results now. We see that 2/3 of our listening audience today say that turnover is very relevant in their organizations and could be added to the business case. And much of the majority are saying maybe it's relevant, but a stronger link is needed. And having looked at some of the turnover research, I agree that there does need to be a stronger link between what we're doing in well-being and addressing turnover. Patty, clearly at Stanford, you through your survey data have been able to say, look, we know that burnout, which is very relevant to health and well-being, is tied to turnover rates here at Stanford. Many organizations lag behind in having that data for their own organizations, and this is actually something that at HERO we're going to be looking at within our HERO scorecard data, trying to look at what are some potential correlates to turnover. So HERO member folks who are on the line and listening in today, be staying tuned for more about that study that we're going to be doing. Let's address the question that Lauren Schutte had that is related to operational efficiency, getting back to, again, the systemic and organizational approaches to addressing some of this. You know, where do you feel like, I know you're at Stanford, you're working with a lot of other organizations to try to address some of this within your model. How do you see companies struggling to address operational efficiency, specifically in healthcare organizations, and what steps would you recommend people take to address the operational efficiency component of your model?
For us, what we're really shooting for as a key word is collaboration and advocacy. So for us in particular, the data shows that physicians on average nationally spend about 32 hours a month working on the EPIC system, documenting their cases that are outside of their normal work hours. And they sort of refer to that as their pajama time, where they go home on a Friday, Saturday night, and that's their pajama time, that they have to take care of what they're legally obligated to do for their patients. In other industries, it may be just the inefficiencies of, you know, their email system, or I often hear that there's inefficiencies in certainly the accounting system. I can say that I struggle with the Oracle accounting system. When I've done some work here at Stanford on it, I will absolutely say it's inefficient. And having me do some of those things is very inefficient. So how do we make it so that we're doing our work at the very top of our game, and our licensure, as if you're a physician, or our abilities? What is the best use of my time and everybody else's? Sometimes HR is not as efficient as we often like. Hiring somebody, I will say, is often a hurdle. That's not efficient. The steps that have to be gone through to hire or to get reimbursement, those are the types of things in a normal business may be just painful for people to be able to get authorization to maybe even go to a conference. They don't really know how to do it, or to take a half a day off, or to get someone to cover their shifts. How much time are we spending on pieces of the job that have nothing to do with what our expectations are for our efficiency and our success in our careers?
Right, but obviously have an impact on our well-being and professional fulfillment. Tim Butler from Intermountain Health wants us to talk a little bit more about how nurses are involved. I know at the start you said that this was initially launched as a physician endeavor, but you have an intention to expand this. Can you talk a little bit about how you've worked with non-physician healthcare workers within your organization?
Sure. And again, I just love the 3 years I worked with our non-physician employees. And that was largely working with our nurses. I will say that the survey, our physician wellness survey, is being adapted to our advanced practice provider teams. There's 600 between the two organizations. So our advanced practice providers will be taking this survey on June 12th, and we will have that survey data. We have also been approached by Lucille Packard Children's Hospital, our children's side of things, and now there's some interest in the adult hospital to revise the survey to measure the teams at both the hospitals. So to shift it from physician focus to professional fulfillment for all of our employees, and to work with them. Now, the collaboration with the non-physician employee wellness program, Healthy Steps and Sherelle, is really a big part of this. I firmly believe that you can get your physicians healthy, but to send them into a dysfunctional, unhappy, unhealthy team is not going to do anybody any good, and vice versa. You can have a very, very healthy team that is being supported by their organization and they're running on all cylinders, and then if you bring an unhealthy physician into the mix, that's going to be disruptive as well. And one thing that I didn't point out, in California, the reason if there's a divide between those two is in California, physicians cannot be employed by the same organization. So they are two different employers, which is why there's two different wellness programs. The employees are employed by the hospitals, but the physicians are employed by the School of Medicine. So there is a disconnect there, and we're trying to bridge that gap through collaboration and support of the entire care team.
Okay, we're going to go to one more set of poll questions here. Patty, one of the things that you said at the beginning was that in your model, just by the very way it's set up, that your goal is to address individual, personal resiliency with 33% of your resources, and the other two-thirds of the effort would be really more systems and organizational level. So what we want to ask our listeners that are remaining on the line, when you consider what percentage of your wellness efforts are currently focused on individual programs versus systemic programs, what would you say the current situation is? Is it 25% or less, where 75% is system, 25% is individual, about a third, where a third is individual, and the other two-thirds is systemic, 50-50, flipping that around, one-third to two-thirds, and a quarter to three-quarters? Describe what your current efforts are. And as people launch that poll, Patty, I know your aspirations are to give these one-third to two-thirds, but what would you say your current state is at Stanford?
Overall, because our resources for personal resilience are truly robust. We've got some of the greatest athletic facilities in the country. We've got the HIP program that's been around for 35 years. We have a tremendous amount. We've got the C-CARES program on campus. We've got the health center. There's so many resources throughout the organization devoted to the personal piece that right now I would say we're probably at about 80%. And I definitely want to shift that through collaboration, the advocacy, the creating, the culture. I'm not saying that people aren't working on the culture, because we do. We have organizational development. We absolutely have teams that are working on those things. But from a very high level, pulling those pieces together, I want to shift it so that we're spending our time really working on the systemic issues. Right.
So some aspirations yet to be seen in your own organization. When we ask the folks that are still on the line, we see that 40% say 50-50 is the current state in their organization. We have 15% that are saying that 75% is systemic, 25% is individual. So clearly there's some variation here, and some people are at various phases in their ability to do this. When you consider culture change within an organization, Patty, we know that it's very difficult. And why do you think this effort succeeds when we're not just talking about culture of health, when we're actually adding that operational efficiency piece? Why do you think that might help us to be more successful in our initiatives by including that in our models?
For me, it's because I have been frustrated on more than one occasion with trying to get something accomplished that should be pretty simple. So I feel the pain of not having the resources and things that we need to get something done. I've felt it firsthand. So when you put the individual in the center of the model like we have, and we let them know that we see the struggles with things like Epic or getting reimbursements or being able to get healthy food at 2 in the morning, there's a lot of things within the efficiency of practice they can relate to, and they want to see those things better supporting them so that they can do their work. So in a medical field, it's actually easier because most of our physicians, all of our physicians, have been hired to do a very specific role. They've been hired to care for our patients, to do the research, and to take care of the role that they've been hired to do. So it's easier in some ways to basically look at the physician role and realize that all this other stuff is impacting them in a way that takes them away from caring for their patients. And what they really want to do is care for their patients. So in a way, the physicians, it's easier to see the struggle with the inefficiencies of practice, But essentially, anything that takes them away from caring one-on-one with their patients is inefficient.
Well, Patty, we've got just so many wonderful comments coming in. People are loving this. We're hearing a comment from Stephanie Brown and many others on the line. I love this. I want more time with Patty. So thank you so much. For those of you who are joining us, thank you so much for extending well past the 30 minutes we typically do these webinars. I want to let you know that Stanford University is partnering with HERO to get a case study developed on what they're doing with their organization. We will be releasing that, so stay tuned on the HERO website for more information on what Stanford is doing. Thank you so much, Patty, for sharing this with us, for helping you and your team leading the industry and leading the nation in addressing the very important issue of physician burnout, and for advancing this model that we have a lot that we can learn from. So with that, Patty, I'll let you get back onto your very busy job, and thank you so much for all of you who've joined us. I hope you'll stay tuned for future events here at HERO. Keep an eye on the HERO website and our future events. We do have the HERO Forum coming up in the fall. Patty, you'll be there at our healthcare.
I will be there.
Thank you so much for agreeing to do that, to continue to share your story. So for those of you who want to hear more from Patty, get yourself the HERO Forum. We'll be there in September, Phoenix, Arizona. Hope to see you there. And Patty, I'll be looking forward to seeing you again there too. Thank you.
Thank you so much.